Nearly 12.5 million cattle are at risk as foot and mouth disease spreads across South Africa, with the Free State declared the epicenter with more than 370 outbreaks. In the Eastern Cape, 40 outbreaks and several suspected cases have been reported, prompting a national response.
We have classified foot and mouth disease as a national disaster and will be mobilizing all necessary capabilities within the state to deal with this crisis.
Shortly after, at least 28 million foot and mouth disease vaccine doses arrived at the OR Tambo International Airport from Argentina and Turkey. According to the Agriculture Minister, the large shipment is intended to allow for double vaccination of each animal to ensure effective protection.
We've got to vaccinate each animal twice. There's an initial shot and then there's a booster shot. So the figure we've put is 28. I mean, obviously there may be more, there may be less, but those are the figures that we are working towards. We're also going to have to include pigs and other cloven-hoofed animals along the way if there is signs that the disease has spread into those particular animal groups. But I'm very confident that the public-private partnership for the importation of vaccines, the public-private partnership between state vets and private vets on the ground, we have the logistics now to be able to roll out at scale.
While acknowledging the focus on high-risk areas, communal farmers in rural regions say delayed vaccine deliveries put their cattle at risk, threatening their livelihoods. They are calling for a review of policies restricting their ability to administer vaccines themselves.
Khona ngoku ikhona enye imazi yaqhwalela apha kulomlenze ngemva endicinga na khona kwangesi sifo xa ke ndibhideka kule ndawo ithi nxa kukho inkomo ibona ayiphilanga ungakwazi uba uyothenga iyeliyeza ngoku kukho isifo uzobanjwa andazi incedo lizawuba yintoni uba amagosa azoba engekafiki ngeli xesha ubuyiyeka isifa kanti incedo belizawuba khona xa uthe waya kwiikhemesti uthenga iyeza.
Ibe nechaphaza elikhulu kuba noko besendibona umhlambi lo noko uyanda ngoku ixhala lam endinalo elinye leloba ezi zishiyekileyo andazi noba zichaphazele kangana kuba ke kha kude kufike gosa kum elisuka kwa-agriculture oogqirha ke bemfuyo uzokujonga.
Besicela ke thina kurhulumente into yobana le vaccine kuthiwa ikhona ngaske ikhawuleze izise ebantwini kuba kaloku le mfuyo yibhanki yethu thina abantu bahlala emaphandleni akusekho misebenzi yawuchaphazeleka imfuyo eyinkomo nezi zigusha nakade zizawuchaphazeleka loo nto yenze into yokubana kwa ivalue yoboya yehle.
Additionally, industry groups including Sekliga and Free State Agriculture have filed a High Court application to block government restrictions on state-controlled foot and mouth vaccines. Meanwhile, the Agriculture Minister says the move is aimed at preventing new strains from emerging following the detection of a fresh strain in KwaZulu-Natal.
They want a vaccine free-for-all, where anybody can import vaccines from wherever they want to and administer them whenever they want to. And the point of this is that, A, it runs a big risk, as we saw in KwaZulu-Natal when some farmers unlawfully and illegally imported the Kenyan vaccine into the country. And that's very dangerous because it contains a strain which we do not have present in South Africa. And in doing so, could introduce new strains into the herd here into South Africa. And it would obviously make our battle against FMD a lot harder.
The court has yet to hear the application. Meanwhile, a nationwide vaccination campaign continues, with officials aiming to cover 80% of the country's cattle by December this year. For Newzroom Afrika on Channel 405, I am Liyema Vumisa in Dudwa, Eastern Cape.